So let's go on and talk about the great pandemic, the coronavirus 2019. And you will notice today that my slides are very wordy. They have more words that I'm used to putting on a slide. I like the minimalist approach. But since I had just a few days to prepare this, literally, I did not have time to make it short. So viruses was first described by Dmitry Yosifovich Ivanovsky in Russia in 1892. He was studying the tobacco mosaic virus. And this is a picture, a nice looking gentleman who lived from 1864 to 1920. So viruses were described at least that long ago. But that's to be described doesn't mean that they didn't exist before that. Some people believe that viruses can, by various techniques of modern science, can be identified as having existed 8 million years ago. So viruses are not new to this world. And there's hundreds and thousands of them. They're submicroscopic non-bacterial pathogens. They're the most numerous type of biological entity. They are the most numerous type of biological entity. And here we thought that ants were the most numerous in this world. Well, viruses are the most numerous type of biological entity, and they consist mostly of genetic material that can be DNA or RNA. They infect all types of life forms. They replicate only inside a living cell. This is very important. This is key. A virus cannot replicate outside of a living cell. They need to be within a host. This is critical to understand. They provoke an immune response in infected animals. This is also important so that we understand the symptoms that they produce. They provoke an immune response in infected animals. And as you've noticed already, in my talk today, I am not going to mention to you all of the routine precautions that you have been bombarded with on TV and in many other ways by everyone, from the CDC to the White House to doctors to the media, everywhere. So I'm not going to talk about washing your hands and so on and so forth, because you know that. And I hope you are all practicing those simple but very necessary preventive measures. I'm going to talk about some of the things that help us understand the virus, because I think that you need to know your enemy so that you can begin to attack it. And here's a cartoon of a virus, and in the middle you see this, it looks like a rope, and it's intended to show genetic material within this round capsule that's around it. And from the capsule or the envelope, certain molecules protrude out of that. Viral populations do not grow through cell division because they are acellular. They are not a cell, therefore they cannot divide. Instead, they use the machinery and metabolism of a host cell to produce multiple copies of themselves. They are truly not living organisms. They cannot divide, but they're very smart entities, very smart. And their purpose in quote, life unquote, because they're not living organisms, but their purpose is to replicate. And they replicate very, very efficiently. And they do that by attaching to the host cell, penetrating the host cell. Once inside, they replicate many, many times over. They use the cell's own mechanisms to then assemble into a virus that's exactly the same as the one that penetrated the cell initially, except that now it's multiplied 100-fold. And then all of these viral particles are released from that cell and go on to infect other cells. It is, my friends, exponential what these viruses can do. Exponential. And here in this cartoon, you see exactly what happens. In a cartoon form, you see the viruses outside of the body cell, and the body cell with a violet-looking
Nuclear.
bean, like a bean inside that body cell. That's the nucleus of the cell.
Mm-hmm.
Was there a comment? Okay. And then I'm going to go through these steps of attachment, replication, etc. The virus first enters the cell, and there are several mechanisms whereby this can happen. Substances in the cell strip off the virus envelope, the coat, and liberate the nucleic acid in number 3 in the center of the virus. So it's in the center of the host cell. So the most important part of the virus, the genetic material within it, is already inside the cell. In number 4, that genetic material, the nucleic acid, then gets into the cell's chemical manufacturing system. It's a very effective invasor, and it uses the host cell's mechanisms to reproduce itself. The cell ignores its own chemical needs and switches to making new viruses. The cell is sometimes destroyed in the process. This is very important. We'll come back to that when we talk about what happens in patients. And many, many, many new viruses are released to infect other surrounding cells and to go into not just the surrounding tissues, but into the blood and go to distant sites in our body, distant organs, and infect cells in those organs too. So again, just to re-emphasize this, the viruses are around the body cell, they enter that cell, the nucleic acid is liberated within the cell, it takes advantage of the cell's chemical manufacturing system in number 4. In number 5, the cell ignores its own chemical needs, switches to making new viruses. It's very effective in doing so. And then those new viruses in number 6 are liberated into surrounding tissues and the blood. So pretty simple, pretty effective, and just astounding how a virus takes advantage of our own organism to do this. Now, we have some ways to protect ourselves from that, and I'll go into that in a minute. So again, we are now all experts on viral replication, attachment, penetration, replication, assembly, and release. These 5 steps are critical because, amongst other things, they're important, very important, because we can design therapies that will attack the virus at each and every one of these steps. And we'll come back to that later. Now, viral size. Most viruses vary in diameter from 20 to 250 nanometers. This is very, very small. In fact, the largest virus measures about 500 nanometers in diameter. 1 nanometer is 0.000008 of an inch. It is said that 20,000 viruses will fit on the head of a pin. You cannot see a virus under a microscope. Even a 1000x microscope will not serve to see a virus. The coronavirus is a double-stranded a single-stranded SS positive RNA virus, about 120 nanometers in diameter. So it's not the smallest, it's not the largest, it's sort of midway, the coronavirus. Now, coronaviruses in general, and please understand that coronavirus is not a specific term to what we're seeing today. What we're seeing today is one coronavirus, but there are several coronaviruses. In fact, someone just coughed, and you may have a common cold, And it is said that 20 to 30% of common colds are caused by one variety of coronaviruses, and that there are several varieties of coronaviruses, all of which can cause the common cold. And we just do supportive care, and nothing happens. By the way, during this pandemic, you are not immunized against the common cold. Anyone can get a common cold. So don't feel that the first thing that will happen to you is the coronavirus, the pandemic one. You may be getting some other illness. You may be getting just a common cold. You may have indigestion. You may have a headache by other reasons. You may have chest pain for other reasons. You may be short of breath because you exercised and hadn't exercised in the last 5 years. So you're not immunized against other things happening. Don't get paranoid and think that the first symptom that you get today or tomorrow is the pandemic. Okay, it can be probably something else, hopefully something else. But we did have an epidemic, almost a pandemic, of one specific coronavirus that's called the SARS, and that was first described around 2003. The severe respiratory syndrome. And then that was contained. And then in 2012, we had MERS, M-E-R-S, Middle East Respiratory Syndrome. And that one is particularly important because these viruses usually come to humans via some animal, some mammalian carrier that transmits from that animal to humans. It is said that many of these viruses come from bats, but bats do not transmit directly to human. There's some intermediary carrier. And for some of these viruses, it's a wild type of cat called the civet. But specifically for MERS, it was the camel, a camel. And this is why it was contained almost completely within the Middle East, because that's where a lot of camels are. And that's how it could be transmitted to humans in that area of the world and was contained to that area of the world. So very interesting about the carriers that transmit to humans. Right now, what we're having is a severe acute respiratory syndrome from one specific coronavirus, a new one, a mutation probably of the SARS, of the original SARS 2003 coronavirus, and it's called SARS-CoV-2 virus. And it started, of course, in China in 2019, as we all know. It's been given a number of different names over these last few months, but SARS-CoV-2 is the one that's being used mostly. The SARS-CoV-2 viruses causes the COVID-19 disease in humans. So coronavirus, CoV, ID, disease, 2019. So that's the name of the disease, whereas SARS-CoV-2 is the name of the virus. And like I said earlier, it can only be seen on electron microscopy, and this is a photograph of such an electron microscopy. And here you see the typical corona or crown around the virus. And those are the protein structures that stick out of the viral envelope. It's pretty graphic, pretty clear, pretty easy to understand why these viruses are called coronaviruses. It does look like a crown around the virus. And here's an artist's depiction of that coronavirus, and you see those proteins sticking out. Those proteins are very important. Those proteins are used by the virus to identify to search for, to attach, first step in replication, attachment, to the target. And the target in the case of humans is what's called the ACE2, angiotensin converting enzyme 2 receptor on the surface of the host cells. And just to reiterate, you see again in this artist's diagram, when you slice that virus in half, figuratively, and the artist shows you the coiled DNA or RNA at the center of the virus. That's the genetic material that the virus wants to get into the host cell. While it is outside of the host cell, it has this envelope that you see here, and it is that red circle around the genetic material. That's the envelope or capsule. And then sticking out from that envelope or capsule are those little end structures that make it look like a corona and are the protein that searches for and attaches to the receptor so that the virus can enter the host cell. Now, human-to-human transmission of coronaviruses primarily occurs via respiratory droplets generated by sneezing and coughing. The SARS coronavirus, for example, infects human cells by attaching to the angiotensin converting enzyme 2, ACE2 receptor, as I mentioned. The interaction of the coronavirus spike protein, that protein that creates the corona, with its complement host cell receptor is central in determining tissue tropism. That is, what tissue in our bodies will be the target for this virus is determined by that spike protein's affinity to specific receptors on the host cells. Infectivity and species range of the virus is also related to this. If you get to the top, human-to-human transmission by droplets, this is of course critically important. This is how we acquire the virus. This is how we develop the disease. And later I'm going to mention why we do that, stay 6 feet apart, why we ask our seniors particularly, meaning most of us in this club, to stay at home and not to be exposed to others. I'll give you just a little bit right now. Someone coughs or sneezes, the virus is aerosolized into droplets containing the virus, and those droplets stay in the air around that person who coughed for minimum 2 hours. 2 hours. Someone said ouch, and ouch is right. Before they drop to the ground, gravity, Newton is helping us, and disappear, because they cannot live outside a host cell. But they do live in those aerosolized droplets for probably, as far as we know today, 2 hours. Now, here's what happens anatomically. On your right, you see a human body, and that elongated structure going from the throat down into the lungs is the trachea. Can you see my pointer?
Yes.
Okay, trachea, larynx up here, vocal cords, trachea, going into the lungs on both sides. And then the trachea divides into bronchi, smaller bronchi, bronchioles, and then if we look at a more high magnification part down here, see that circle? Mm-hmm. This is it. Bronchi divide into smaller and smaller bronchi and invariably then they divide into the smallest of bronchi that we call bronchioles, bronchioles, and end up in this bud-like structure, which are the alveoli. So here are the alveoli, and there's where most of the exchange of gases takes place. You know, we want to give up carbon containing gases, CO, CO2, and exchange that for oxygen, and that is how we breathe. And that exchange occurs because these alveoli are very extensively vascularized. You see all of the arterioles in red and all of the veins. The arterioles bring blood, and that blood contains the gases that are to be exchanged here, and then the veins take back, or the other way around, the veins bring in the gases and the arterioles take back the oxygen that we need. That's how we breathe. All viral proteins are recognized by the infected host as foreign. That's how we defend ourselves, okay? We have an immunologic system that is very intelligent and is able to recognize things that belong to us, proteins that are part and parcel of our organism, proteins that are self versus proteins that are not part and parcel of our organisms, proteins that are non-self. So they're recognized as foreign. And then the host's immune system will mount two kinds of response to fight this invader. One is called humoral immunity. The B lymphocytes in our blood, white cells, make antibodies to the viral protein and neutralize or destroy the virus. This is how we defend ourselves. Or secondly, cellular immunity, where again, cells in our blood, white cells in our blood, this time they're not producing antibodies, they're actually being killer cells, killer T cells that recognize and kill virus-infected cells. And remember, viruses do not grow or replicate within a dead cell. So once the killer T cells kill the infected cells, the virus cannot reproduce within that cell anymore. However, not infrequently, the virus-specific T lymphocytes, the killer cells, kill vital cells such as liver, kidney, lung, and other cells that carry out important functions. Why? Because they're infected. And the T cell kills those cells that are infected. However, those cells may be important cells, and they may be there to carry out important functions, and yet our immune system has to kill them because they're virus infected. And that's how you get symptoms, signs that have to do with the liver, kidney, lung, and other vital cells. Additionally, cell death results in an inflammatory response that can damage normal tissues. So a cell dies and antigens are liberated, bits and pieces of that cell. The inflammatory response occurs, but takes care not only of those bits and pieces of cellular debris, and the dead cells, but can damage the surrounding normal tissues. Thus, diseases caused by viral infections are the result of the host's own immune response. We are so affected, our immune system is so effective that it goes beyond the infected cells and harms other tissues that are around it. Again, many diseases resulting from viral infection are caused not by the virus, but rather by the host's immune response.
Antonio?
Yeah.
This is Kim. I just wanted to mention we're just about at the end of our usual meeting time, but this is critically important, and we still have about 48 people on the line. So if you're willing I'd like to propose that we go on for another 15 minutes or so and invite everyone who's able to stay on, because I think this is fascinating, and it's also a critical matter for all of us. So if that would be okay with you, we would much appreciate it.
I'm having fun, and I have a lot of time. I'm not going anywhere, literally, and I've had my coffee already. So
Okay,
yeah.
perfect.
I
Thank
hope
you.
this is interesting to all of you.
Yes, it is. It's extremely interesting and important. So we are most grateful.
I'll try to go a little bit faster and yet not lose most of you if I can.
When his coffee kicks in, he'll be going faster.
I'm sorry?
When Antonio's coffee kicks in, he'll be going faster.
Okay. I will go over this one. We've discussed this already. Let's talk about prevention. Prevention is simple. Number one, follow all precautionary measures. They're all over the media. You can read about them, you can see them, you can hear people talking about them. I'm not going to go through this, you know. When they say wash your hands, do wash your hands. When they say stay at home, for heaven's sakes, as much as possible. Testing. Everybody wants testing. Everybody cannot have testing. Everybody does not need to be tested. It's a horrible waste of resources. We do not need to do that. You should get tested only if symptomatic and only in certain situations. Because if you're tested because you're the mayor of the city, or because you're the governor of the state, or you're a very important Lady Gaga type of actress, and it's negative, there's nothing to do. There's nothing to do. And yet you turn around, somebody coughs in your face, and you can be immediately infected and turn positive. So what are you going to do with a result that's negative? Not much. If you are positive, on the other hand, and asymptomatic, again, there's nothing to do. Do not start empiric therapies. Do not go and look in your medicine cabinet and start taking everything that's there, or do a mad rush to go shop at your local Rite Aid and pick up the dozen things that are being touted as being good for coronavirus, because most of them are not. And be careful. Take your daily medicines. Take the medicines that have been prescribed to you, and don't take other things that you think might be useful but could actually be harmful, and you don't know it. You don't know it. Could, in fact, stimulate replication of the virus. So be very careful. Don't take anything extra that you don't need to. Now, if you're positive and symptomatic, and I don't mean just you sneezed once and you go get tested, but certainly if you sneeze, cough, and get short of breath and have a temperature, my rule of thumb, 100 degrees or higher, call your physician right away, and he will give you instructions on what to do. And that's one instance when you may definitely need to be tested, not otherwise. What treatment do we have? If your symptoms are mild, you have a little cough, a little sore throat, a little bit of a fever, but not much, you do supportive care. You know, you're not short of breath. This may be just a common cold caused by some other coronavirus or by a rhinovirus, which in fact causes about 60% of colds and is indistinguishable. But you'll have mild disease. You do what? The usual, you take cough medicine, you take some Tylenol, you get rest, drink a lot of water, etc., etc. But you don't go get intubated to receive oxygen. You don't go immediately and get tested. to see if you are positive or not. Don't. As I said initially, you're not inoculated against mild viral illnesses that occur every day. And some of us have them rather frequently, and they're around and even more ubiquitous than coronavirus. Or you may have influenza, you know, and then you'll get symptoms that are perhaps moderate. And you'll know when you have to call your physician, you know, and he'll make sure that you're immunized against influenza, or if not immunized, he will prescribe an anti-influenza medication like Tamiflu or something of that nature. But you don't need to go to the hospital, you won't need oxygen, you won't need et cetera, all of the other measures, and you will not overburden our medical facilities and our medical staff that are starting to get overwhelmed in different parts of our country. And you look at what's happened in Italy, and it's incredible. You don't want to contribute to that. Excuse me. If you have moderate symptoms, then you know, call your physician, because if you're getting dehydrated, you may need IV fluids. If you're secondarily infected and bacterial infection occurs frequently, even with a common cold, you can get secondary bacterial infection. And in the more mature people like us, you can get bronchitis, pneumonia, etc. And you may need antibiotics. And if severe, you may need oxygen, and so on. Call your physician. If you have severe symptoms, severe disease, if you have chest pain and shortness of breath, if you have a temperature of 100 or above, if you're coughing continuously, you may have severe coronavirus disease, COVID-19, and you may have to be hospitalized. Don't wait very long if you have those severe symptoms to call your physician and do anything that's necessary. It's critical, if you have those severe symptoms, to get treatment right away. Now, who is prone to get the severe symptoms? Because let me tell you, go back to the previous slide, most disease is going to be mild. And I'm not going to talk too much about statistics because, frankly, we don't have the statistics that are accurate enough that we should even be talking about them. It reminds me that someone said, it may have been Mark Twain, liars can figure, figures don't lie, but liars can figure. And we have a bunch of people, and I'm not calling them liars, but we have a bunch of people talking about statistics and modeling and so on that are incorrect because we just don't have enough information, number one. Secondly, because most of the experience is in China and we can't trust what they're reporting. They're probably under-reporting. Thirdly, because this disease, we're learning every day more and more about this disease. This disease probably occurs in an asymptomatic way in some proportion of our population. And friends, we don't know who they are. You may be standing next to a family member, to a friend, to a neighbor who has the disease and will never have symptoms. But if his throat is swabbed, or if her sputum is analyzed, or if that person coughs and the aerosol is tested, they will have the virus. So what proportion of this pandemic occurs in entirely asymptomatic people? We don't know precisely because they are asymptomatic. We do know only those that have symptoms and get tested. At some point, we will have enough resources to test perhaps the entire population, then we'll find out. Right now, we don't have those resources. And we cannot utilize what we have to diagnose asymptomatic people because most of them will not have the disease at all, but some do. Now, a significant proportion will have symptomatic disease. It will be mostly mild. There will be some moderate cases, and then there will be a few severe cases. Several different percentages have been bandied around that perhaps 10% of the population will develop moderate or severe disease. I would say that probably thereabouts, but frankly, we don't know. What are the risk factors for developing severe disease? Age. And in our club, as I said, most of us are above age 65. Kim, thank you, and others for providing me with the data yesterday. 44% of our club is over age 70. 44%. I don't know how many of us are over age 80, but I'm there. Just turned 80. And that's a risk factor because our immune system is not the same as when we were younger. Also, patients who are immunosuppressed by different diseases, by cancer therapy, by chemotherapy for different reasons, they are immunosuppressed. In some patients, it's congenital. Other patients have lung, heart, kidney, or liver disease, which will make them more susceptible to the viral illness. Others with diabetes or autoimmune diseases or cancer are also very susceptible. So these are the risk factors. And many of us have more than one risk factor. Stay at home. Stay at home. If you have very severe infection, you may develop what's called a cytokine release syndrome. And Cynthia, again, thank you for juggling my memory on this, because I have had patients who develop cytokine release syndrome and have had to manage some of those patients, and there are ways of managing them. And what happens in cytokine release syndrome is that when the immune response to viral infection happens, when those infected cells are killed and destroyed, when virus is released into the surrounding tissues and into the blood, and the immune system is trying to kill them all, and it's very effective in destroying those cells, then those cells will liberate the things that are within them that normally are not harmful, but in excess can be harmful, like tumor necrosis factor alpha, TNF alpha, cytokines such as interleukin-6 particularly, and other cytokines and chemical mediators that are then liberated into our blood, and they cause a variety of symptoms. They're useful, but they are toxic also. Also, there is cellular debris liberated into our blood, because you kill a cell and you destroy it, and there are bits and pieces of the cell circulating. And there are macrophages and other phagocytes in the tissues surrounding that happening, and they try to gobble up those pieces of cellular debris and dispose of them, but they can overwhelm the phagocytes' capacity to do that, and they just circulate freely in the blood and can trigger all sorts of harmful events to our body. Now, we do have therapies that exist today that are available but are not approved for COVID-19, because we never had COVID-19 before. So there's nothing in existence that has been approved by the FDA specifically for COVID-19, but are approved for other indications, are available, are on the market. The problem that we have is that we don't know exactly how to use them, because again, we're just learning how to treat COVID-19. We don't know if they are specifically active for COVID-19. They may be active for other viruses, but not for this one. We don't know how to use them in combination, and you probably are going to have to use them in combination with one another. We don't know at what stage of the disease to use them. Do you use them very early on? Do you use them preventively? Do you use them for mild, moderate, or severe disease? If you use them for severe disease, at what stage in that severe disease do you use them? A lot of unknowns. But my friends, if you have severe COVID-19, this is the time to take risks. This is the time to take chances. This is the time for the FDA to forget whether something is approved specifically for COVID-19 or not. They should allow the use of these agents without much bureaucracy. They're not doing that. Yesterday, I saw the commissioner of the FDA lie through his teeth to this entire nation and to the president and to the White House staff and say that some of these agents could not be used because they have no FDA approval. And no FDA approval means that they will not be covered by your insurance. I think that this is criminal, and I have other nastier things to say about the FDA, but this is not the time. So the existing therapies that we have are known antivirals, known antibodies, and just about at least half of the pharmaceutical industry is nowadays producing antibodies. Our group at IDEC opened the floodgates for this back in the early 90s, and everyone is producing antibodies for just about every disease in the world. It will not be difficult. It's already being done to turn this machinery into producing antibodies against this COVID-19 virus. Interferon has been around forever and is an effective antiviral. It does have a place, but again, you have to be very selective. Hydroxychloroquine or chloroquine, a very well-known for years antimalarial drug, is widely available, is said to be effective, but again, you have to be selective as to who gets to use it, how it's applied, at what stage of the illness. Don't rush to your local pharmacy and buy chloroquine and start taking it today. You can end up with no hearing. You can end up with no vision because it's toxic to the eyes and to our auditory system if taken in excess. So you have to be careful with these drugs. You have to trust your physicians. They know what they're doing, and they have to figure out this incredible puzzle that is the treatment of this pandemic. Anti-inflammatory agents are useful. Do not rush to take Celebrex. Do not rush to take ibuprofen. It has a role. Don't start taking it now. Let your physician decide. Corticosteroids, prednisone, dexamethasone, and others can also be effective. They have their place. They have their place, but they do not have any place. None of these existing therapies have any place at all in self-treatment. So hold your horses. Other possible therapies in the immediate future and being investigated already are vaccines, the use of immune plasma. Someone gets the disease, recovers, is doing well. Their plasma will contain antibodies against the virus, will contain cells against the virus. You could conceivably take someone's plasma, someone who's immune, and give it to a patient that's just undergoing viral infection. Eventually, we'll be able to produce immune globulin. That means take the plasma and further segment it into different components of plasma, one of them being immune globulin, namely the antibodies against the virus. And then we'll have all sorts of targeted therapies. If you remember the replication cycle, attachment, penetration, etc., we can target each one of those steps and subsets of those steps. And that, I tell you, is happening today. It may not be around for a while, but it's going to happen. We are going to have cures for this viral pandemic. We will survive. this too will pass. Thank you.